Despite an accelerating vaccine rollout, Dr. Michael Osterholm, a member of President Joe Biden's Coronavirus Advisory Board, said on Sunday that the U.S. will face major challenges in battling the pandemic before summertime, warning the UK coronavirus strain infects children more easily than previous strains, something experts are still debating. We really are in a Category 5 hurricane status with regards to the rest of the world. This B.1.1.7 variant infects kids very readily, Osterholm told Meet the Press. Unlike the previous strains of the virus, we didn't see children under 8th grade get infected often, or they were not frequently very ill. They didn't transmit to the rest of the community. B.1.1.7 turns that on its head. The B.1.1.7 variant, which experts believe started in the United Kingdom, was first detected domestically in December and is one of just 5 variants of concern, identified by the Centers for Disease Control and Prevention. The CDC reports that it's still unclear how the disease caused by these new variants differs from the disease caused by other variants, but U.S. state officials have warned that the UK variant has been linked to increased infection in children. However, UK medical researchers concluded in February that the clinical impact of the strain on children was yet to be fully defined. They found that the second wave of infections in the country, dominated by the B.1.1.7 variant, did send more children and young people to the hospital, but said it was likely the higher prevalence of COVID-19 at the time that was responsible for the uptick. They also found no evidence of more severe disease having occurred in children and young people during the second wave, thus suggesting that the variant does not result in a more severe infection among children than the original COVID-19 strain. Meanwhile, experts in Israel and Italy have also noticed an uptick in the rate of disease among children as new variants spread, but one Israeli official said there was no evidence yet that the new variant is more dangerous to children. Osterholm's warning comes just 2 weeks after the CDC issued new guidance on school reopenings, relaxing their physical distancing recommendation from 6 feet to 3 feet. Other strains not labeled variants of concern are also starting to spread quickly. The B.1.5.2.6 strain, known as the New York variant, represents more than 40% of current cases in New York City, Torres said Sunday. Meanwhile, the number of new coronavirus cases in the country has jumped 19% in the past 2 weeks, with nearly 64,000 infections reported Saturday. I think that there's enough immunity in the population that you're not going to see a true fourth wave of infection, Scott Gottlieb, the former head of the Food and Drug Administration, said Sunday.